My experience with the Seniors Innovation Lab was an eye-opener for me.
It was very enlightening because I was so happy to see that there were so many people that cared.
I jumped at the chance because I thought this is a great way for us to meet up with other organizations and, try and help do some problem solving.
I realized if I didn't speak up, I wouldn't see a change, and I need to see a change.
I think a lot of seniors feel like they're out there by themselves, but they have to know that they aren't, that we are trying.
When I joined this group, there was so many people that actually listened and asked questions.
I found it a very positive first step.
I came away with a great feeling of community connectiveness, expanding access for seniors.
Housing Challenges started with me probably about 8 years ago, when I realized I wasn't going to be able to afford to live in the West End anymore.
One of my uncles went to join the army. In order to do that, he had to give up his status. So when he came back, he wasn't allowed back home. He didn't have a home to go to.
A face-to-face help. Don't put them on the computer, don't phone them. They need somebody to go and walk them through it, step by step. Then they need to follow up to make sure that they've understood it, because people feel overwhelmed.
We have rent subsidies, but not everybody does. There's not many of those places out there, and that's what they need more of.
What next? Well, I think first of all is doing, of course, the presentation tour, being really inclusive of owners, operators, landlords of housing situations, building housing. We need more housing. There is nothing out here in our community now for seniors, and particularly for seniors who may be at risk.
I really want some action. I'm 76, and there are a lot of people my age who are living on the street.
The federal government, plus the other governments, to stand up to the Universal Declaration of Human Rights. And the number 25 is the human rights to housing. And I'd like them to address this issue and not take years to do it. It has to be done.
Isolation is becoming a real issue for a number of them. Mental health, decrease in their mental well-being, emotional well-being, cognitive issues. Many of them are isolated also because they don't have access to nor can afford, for example, digital and new technology.
Right now, downtown Eastside is the only place where they could build all these low-income housing places. It should be throughout the city.
I want the city to take their land, put people in it, all people. But I'm focusing on seniors, of course.
One of the things that we have seen with low-income seniors who are facing challenges in their housing is they may not know who to turn to for support.
HSABC predominantly works with seniors who are either at risk of homelessness or those who are already homeless. So a lot of our work has been around research.
People are housed incorrectly and don't get the level of support they need. And these can have tragic ends, can lead to homelessness, can lead to premature death, and can lead to a very poor quality of life for quite a number of years for quite a number of people.
prior to starting with HSABC, I was with a local frontline service provider organization that worked a lot with isolated seniors. And through that work, I was leading a process, a human-centered design process around seniors transportation, and looking at how seniors move through our communities and access services. And obviously a big piece of transportation is housing. So the areas overlapped considerably.
As a younger person, I'm so passionate about bringing attention and bringing to light the fact that our seniors, so many of them are falling through the cracks, especially during a housing crisis, as well as through COVID. And this is an opportunity for us to bring forward solutions to our community so that we're able to support them in a way that's meaningful and effective.
These are complex problems, and no one organization can solve it on their own. There's no other way other than a collaborative to solve it. So when we found out about the Housing Lab, we absolutely wanted to be involved because it gives us a chance to learn from our peers, to inform what we're learning and what we're experiencing, and to see how we can take a systemic systems approach to solving these problems on behalf of the seniors.
Moving forward, what we need to see happen is for this topic to be really at the forefront of the conversation so that people are aware of what low-income seniors are facing in the housing market.
I think making sure that we not just create space, but really empower seniors to be the dominant voice in decision making around program development and delivery.
I think we're building on a position of strength. We've got a lot of organizations around the table. We're learning a lot from each other. We're coming up with solutions. I think what needs to happen next is we need to put these solutions into action. We need to be working with levels of government to put forward these ideas. I know a lot of them are hungry to hear new ideas because they know there are gaps and problems in the system.
We need to see that housing is a key determinant to health, and that we need to have active engagements from health professionals and health providers directly with housing and homelessness services.
I'm so passionate about finding a solution to providing support services for low-income seniors and housing, because as a Canadian, I want to feel proud that we're able to care for our citizens, that we're able to support people, and to watch a senior become homeless, to me, is absolutely unacceptable. If we can work together and find a solution to this, I truly believe we can prevent that and not only help seniors to remain housed, but to remain housed well and thrive in their later years.